Good morning, everybody, or good afternoon, depending on where you are. Thanks for the introduction. We had the pleasure of presenting this, as was said, at the IBI conference in San Francisco in March. What we're going to talk today about, our agenda, is just describe Fraser Health, the summary of our problem that we encountered about 7 years ago, and how we resolved those issues, and the systems that we use to resolve those issues. And then Tyler will talk about the solution that we use, the StaffRelay EARL solution. So next slide, please, Tyler. Fraser Health is the largest health authority in Canada as a singular health authority. We look after and provide services to over a third of British Columbia's population. And in the Lower Mainland, just outside of Vancouver. And we provide services across the spectrum of healthcare. We have 12 acute care hospitals, outpatient care and surgery center. We have residential care, long-term care beds. We have mental health, public health, home and community care. So across the board, it's both tertiary, regional, and community-based healthcare, and based on the Canadian public healthcare system. So it's publicly funded and has all of the benefits and downfalls of a publicly funded system. So we have a lot of pressure for us on growth. It's a fast-growing area for our residents, and so we've been growing as a healthcare organization anywhere between 4 and 10% a year over the last 10 years. So it's been pretty rapid growth since Fraser Health was formed in 2002. The next slide, Tyler. So in 2008, approximately, we received a letter from our long-term disability insurance coverage provider. In British Columbia, we have a healthcare benefit trust that all of the healthcare organizations pay into. So it's a non-profit trust, and that trust goes out and obtains LTD insurance and benefits providers for us on behalf of the pool. So we received a letter from our healthcare benefit trust in 2008 indicating there was a large unfunded liability in our long-term disability plan for Fraser Health. And the main issue with that letter, of course, is that we had no idea that it was coming. We had no sort of trailing or leading indicators to indicate to us that the problem had increased to the point where it was large enough that we had an unfunded liability. We had a real lack of detailed absence information. We had a electronic health record database for our staff, but it was all based on individual staff. We had no overall aggregate data, little trending data, and no real analysis of any of the absence data. Our disability management was siloed, had different, a lot of handoff points, different roles and responsibilities across the system. We had people looking after sick time, people looking after long-term disability, people looking after workers' comp, and so really no ability to analyze the data in real time. Often we were doing things at the end of the fiscal year for analysis, which was obviously way too late. And we also had no way of identifying people who were going off in real time. So often we would get a note, either a doctor's note faxed into us from a manager saying, this person is going off for 3 months. or this person's been off for 3 months, and what should I do about it? So we had no way to really have an effective either stay-at-work program or really an effective and dynamic return-to-work program. We, at the time, were also in contract negotiations with, as a province, with our main healthcare unions, and there was some language being inserted into the collective agreements that were enhanced disability management program language, which required us to contact staff who were off after 5 days of absence, and requiring us to do certain elements of a disability management program that was upfront and right away. In return, the employer got a requirement for mandatory participation in disability management. So it was a real opportunity as well then to change our system and to drastically improve it. Next slide, please. So we engaged a outside consultant organization to walk us and lead us through both a lean improvement process and a Six Sigma review and process redesign. We had extensive union participation, and we implemented our enhanced disability management program, and along with that, 2 systems to allow us to meet the requirements of that program and to allow us to implement our Lean Six Sigma review process. And that was a provincially developed database for electronic employee health records, as well as an automated attendance reporting solution. So we came up with an acronym, of course, being healthcare, and called it EARL, which refers to the Employee Absence Reporting Line, but it was the Mgmt solution that you'll hear about later. And the EARL solution acted as a way for us to have consolidated absence calling and on a daily basis, so that we knew the system tracked and identified staff who were off for our more than 5 days consecutive, which was our trigger point for our enhanced disability management program. So the solution is put into place. It maps out every employee in the organization of who their sick or absence reporting goes to, and then when you call in as an employee, it gathers that data and then routes you directly through to your manager or supervisor. So you still actually talk to that person to tell them that you're not able to work. But the system collects the data along the way and then routes it through to the disability management staff. So next slide, Tyler. So EARL has in Fraser Health has really an identity. It's kind of funny that our system has come up with. It has an identity, it has a name, and people do pay attention to it. We have reporting up to our executive on our systems and our results. And so we have started doing some annual reporting and dashboarding for executives and managers. But so you can see from the slide that over a 5-year period, we had over 600,000 calls to the system. And we track a lot of indicators for the system, and we use the data to try to identify improvement points. So from the 2014 annual reports, one of the things that we had analysis that we did was that our casual absences accounted for 17% of the calls. Our casual staff, in our definition here at Fraser Health, do not receive sick benefits or other benefits, and so they're just the staff that get called in to cover shifts. But they were also calling in sick for the system, and this was impacting overtime replacement costs and other costs for the department. So it's just an example of utilizing system data for actually some financial analysis in the system. But most importantly, just over 2,000 staff were identified through the automated real-time system that met our criteria for our enhanced disability management and were referred to my team in the Workplace Health Department. Next slide, Tyler. So we do track from a dashboard perspective the results from improvements from our Lean redesign, Six Sigma process design, and implementation of our systems. So for our occupational injuries covered under the workers' compensation coverage, we are looking at approximately, it's 2014 September, we're looking at approximately 86% return to work after 12 weeks. This is a dashboard that we do track. So we track the less than 4 weeks, 4 to 12 weeks, 12 to 26 weeks, etc. So we've shown great improvement in our return to work timelines. Next slide shows the improvement in our duration reduction for our short-term disability duration under the workers' comp category, and that is since May 2010 on the far left axis up to October 2014 on the far right, showing the improvements along the way. It's been quite dramatic, and both in time and dollar percentage improvements. For the next slide is starting to describe the non-occupational injuries and illnesses. So we have in BC an accrued sick bank that we accrue and pay out for short-term absences and illnesses. We do not have a short-term disability insurance program. And after 5 months of absence and being disabled from your job, you are eligible for long-term disability coverage. So we have about 290 cases started per month through using the EARL system. EARL accounts for at least 60% of all referrals, followed by manager referrals, and people who are going through our HR attendance management program sometimes indicate that they have a chronic illness, and that's about 10% of our referrals. So we've improved our contact times. We measure our contact times, and we've improved our contact times to 5 days to our first attempted contact, and actual contact to an average of 7 days after absence, and that we're averaging about 8 days for our case start, where we actually get people into services. Another unique feature of our EARL system is that we can do a reverse call, and we can contact a list of employees using a reverse call process. And we have used this system several times. When we had a measles outbreak at Fraser Health, we messaged the staff that we did not have the vaccination information on, and we're able to get a message out to them, as well as our annual flu vaccination campaign. We also now have online dashboards and reporting for managers, and gives the managers an authenticated report that shows them their data, their employee data, and all of the system usage for themselves. On the next slide is just a graphical representation of our referral points into our enhanced disability management program, showing the vast majority come to us on a daily dynamic basis through our EARL system. Next slide shows that for our medical leaves that are greater than 5 days, we're quite happy to say that 86% of the cases ended up returning to work in their own job own job after receiving services through our enhanced disability management program. So we do triage them. We do have a process to identify services for them and get them into services wherever possible. Because it's through our insurance provider, we are able to expedite services and do not have to stand in line through the public healthcare system. So we're looking at constantly improving our first contact timelines and our case management timelines, and so we're down to about 4.91 days on average for our first contact made by our disability management staff. One of the other, on the next slide, shows that one of the other unanticipated benefits of using the EARL system is also being able to forecast and look at aggregate attendance management data. And we do track, high daily usages. When do we expect to have high sick calls on a daily basis for the entire organization? Kind of ironic being in Canada, but snow does impact us to a great degree in Vancouver here, that people seem to get sick when it snows. We do know that when the local team was in the Stanley Cup Finals, that our sick calls went up for the hockey playoffs. We hosted the Olympics in 2010. Again, high sick calls the day after Halloween, so Halloween's become, the adult holiday, etc. So what it does, it allows us, the organization, to deliver messaging to staff on an aggregate basis, not blaming or pointing out anybody, but doing positive messaging, saying we're concerned about your health, and make plans to be able to deal with bad weather or school closures or whatever. So aggregating the data from our system allows us to do that as well. Next slide. For my team, is one of the sort of key indicators for us is that despite from our long-term disability claims management perspective, so these would be staff that are off for more than 5 months, and between 5 months and 2 years usually, and then some about 40% go longer than 2 years, depending on their issue or condition. The claims management, disability management systems that we put in, we managed to, despite the fact that there's about 250 new claims per year opened, that we've been able to maintain our number of active LTD claims in our pool at the same level over the past 5 years. So that means that despite, basically for every 250 new claims opened in a year, we're closing or returning to work 250 approximately claims over the year. So it's a real point of pride for ourselves, and it realized high dollar savings for the organization as well. And in the next slide, you can see the dollar savings. So this is we're a self-funded LTD pool, and so you can see that over those 3 fiscal years that are indicated, the dollar return in Canadian dollars, dollar return directly back to us in reduction in assessments. So 8.5 million in 12-13, 15.8 million in 13-14, and 6.7 million in 14-15. The graph below shows the timelines. Our LTD claims incident rate per 1,000 covered lives, which is what our insurance company measures, and the points in time where we actually implemented the lean design results for disability management in 08-09, and then the go live of our system in around end of 2009, beginning of 2010, and then the drop off in our new claims incident rate since then. So graphic representation of the improvements that we made to our system. Next couple of slides. The next slide shows dashboards that are available through the EARL system for managers, staff, supervisors, and executives. So depending on your position, you get different dashboards. But this is real-time data, so this is daily. The data gets updated every single day. So you have either calls per month, per week, various indicators that show what's happening at an organizational level. As well, on the next slide, it shows right down to an employee level. So we're able to map and track the disability cases that the employee is in, and then some charts that overlay sick time usage and overtime usage and productive hours and sick hours coded. So managers have this available to them for every single employee within their cost centers, and this allows for really active management of the case. So I think really to summarize, starting out with a really detailed, comprehensive review, analysis, and redesign of our system, we've implemented new processes, but they're really supported by our two systems, our electronic health record for employees, and then the EARL system, which is the daily absence call information. And so we achieved a 40% reduction in our long-term disability assessment rates, and that's translated to about $28 million that has been plowed back into the provision of health care for Fraser Health residents. So we're extremely proud of the results of this program, and we think it's a really good indication of what a thoughtful and iterative process that we've gone through and been able to maintain and sustain over the last 5 years. So Tyler, I'll turn it over to you.
Great, thank you, Dave. I'm assuming everybody can hear me now. Yeah. That was a very insightful presentation. We definitely appreciate that. So what I'm going to do now is talk a little bit more about the intricacies of the solution that Dave and his group at Fraser Health deployed. They white label it as EARL. Many of our customers choose to white label it. At the end of the day, it's a day one real-time absence tracking solution for folks, and we pretty much rely on the customers to come up with their own very insightful name. Unfortunately, our tech team is not the most creative when it comes to that. Their strengths are in other areas, and that's really on helping organizations track and report on absences in real time using a day one system that's completely automated if desired. So a little bit about StaffRelay. There's about 130,000 lives covered on any given day through the system. That number has since increased since we made these slides back in March. So we're sitting at around 145,000 or so all in. And all the customers use them for different reasons, but for the most part, they focus in on FMLA, workers' comp, all non-occupational, casual, incidental, culpable, non-culpable, anything that you can possibly choose to track in real time and have data on can be input into the system and then used to manage those absences. And there's a few different vectors that people can use to report an absence. They can either call in an IVR system, which is an interactive voice response system. So it's, an automated line, an automated attendant that answers the phone, runs through an authentication number, usually an employee number or a password tied into that, and then they ask some questions around the specifics of the specific absence in terms of, does it start today or does it start tomorrow, what's the expected duration. And when Dave was talking about the 5-day piece, every customer has a different sort of cutoff for where they want to elevate and triage up to a higher level of absence management. And in Fraser Health, that is 5 days. Some organizations use 3 days. Some organizations use 4. Some people are very lenient and don't kick in until 10 days. But at the end of the day, the system can be modified to basically track whatever it is that you want. You're still going to be able to report in real time on day one, but at the end of the day, where it gets elevated to the next level of tracking is entirely up to the customer. There's also a mobile or smartphone application that will be rolled out this month, as well as a desktop or web browser piece that's actually used by call centers. It's actually very interesting when you look at North America, which is where we find all of our customers. On the Canadian side of the border, most of the customers want the call after the pertinent information has been captured to be routed to a supervisor to basically complete the loop, as I like to call it, or run through a call center where you capture that and then route it through to the supervisor. Whereas all of our U.S. customers really don't want the call center option at all. They just want the data tied into that. We're entirely flexible with regards to enabling them to track this sort of thing. And obviously, once an absence has been recorded, it's registered in the system immediately. So then, as Dave showed some of his real-time reports, that will automatically get updated if they're logged into the system, or the data can be pushed back into an existing attendance management system or timing and scheduling piece on an hourly basis, or every 8 hours, or on a 24-hour basis. It's entirely up to the customer as to whatever they want. But what's very useful for a variety of different reasons is the ability to actually send a text message or an email, as well as the dashboard applications, to relevant individuals. So if somebody at Human Resources needs to know, or if a supervisor or a manager needs to know, that can all be wired into the system. So as soon as an employee registers an absence, a few people get notified of it simultaneously. We are very much an industry agnostic provider, although Fraser Health is from healthcare and have a huge organization and many of their partners tied into that sort of thing. Anybody who has a problem with absenteeism, where it needs to be tracked or it needs to be managed and reported upon, at the end of the day, they can benefit from using this sort of system. StaffRelay is very much highly focused on the real-time data aspects of it, the dashboarding, and obviously supporting the analytics initiatives that exist out there. We can integrate in with existing HRIS or ERPs, as well as EHS systems. So that's the Oracle, the PeopleSoft, the Kronos, the SAPs, and that sort of thing. So really what we're talking about here is having robust absence data as the foundation of many of the integrated absence and disability management solutions that organizations may have. And as Dave mentioned, the biggest thing for Fraser Health was the ability to identify folks, intervene early, and then head off an LTD claim down the line. Those were obviously the most expensive drivers of their costs. But, that's not the same for every customer. Some folks really want to focus in on casual and incidental absenteeism, or they want to focus on, reporting on FMLAs and tighten up that sort of process so that you're not taking too much time to initiate management and tracking of these sort of things. Now, from my point of view, I'm an epidemiologist by training, so my area of expertise is within the health and productivity paradigm, figuring out ways to use data to help businesses improve their operational outcomes. And you really can't manage anything if you can't measure it in one form or another. Obviously, your measures have to be valid at the end of the day, but that can be done through a variety of different means. So these data really help organizations to identify, what the current state is, where to set goals, and then work towards managing, the lost productivity, the higher replacement worker costs, overtime, and all that sort of stuff that we know goes along with absenteeism. And of course, the health and productivity benefits for this audience in particular really can't be ignored. And I assume we're speaking to the converted in this respect. So really where I think the industry needs to focus in on, and of course I'm not just talking about StaffRelay or our solutions here, this is more of a broad sort of presentation and discussion, but day one or day zero concept reporting is really where it needs to be. I do a lot of work with workers' compensation, and one of the things that we find is that when delays are entered into the system, you lose the ability to plant the return to work seed with that worker right away if you don't know about it. So if you're running and managing your absences based upon payroll data, which may not be run for 2 weeks at least from a given report up into 3 weeks or sometimes even monthly, you've lost the ability to intervene right away, plant the return to work seed or that stay at work seed if it needs to be there, and really start managing towards that sort of outcome. So from my point of view, and I use this next quote to pay homage to a colleague of mine who's a performance management expert in workers' compensation, and she basically says this to everybody who she speaks with about reporting times and performance when it comes to workers' comp, is that when performance is measured, performance improves. And when performance is measured and reported, the rate of improvement accelerates. So, and obviously there's lots of research to support this sort of thing. But at the end of the day, really what we're talking about is having good solid measures and metrics in place, having them track what you need to track, when you need to track it, and then reporting back to individuals and holding them accountable from a variety of different points of view really helps drive the process. And performance at the end of the day is measured with data. And data are the framework to both measure and evaluate your absence and disability management solutions. So then knowing what we know about this sort of thing, then why do we still have 80% of large organizations in the U.S. not tracking absences? And of course, that's from the Marsh and Mercer report from 2010. I am very hopeful that number has come down in the past couple of years. But according to my discussions with some IBI folks back in March of this year, I don't think that number has decreased dramatically. So from our point of view, and obviously from a lot of operations folks and a lot of people within industry, this represents a significant opportunity for cost recovery, for improved management, and all the myriad of other benefits that we know go along with tracking and managing absenteeism within organizations. So in order to effectively manage your absenteeism and disability, you really need accurate, valid, and timely data in order for you to make the most informed, best decisions possible. And of course, you really can't negate the fact that in some instances these decisions are going to need to be defensible. And having an electronic automated system in place that tracks when an employee called to notify according to or following the procedures goes a long way towards having a defensible decision in place. And so once you have, timestamps and all that sort of thing, there's no more he said, she said sort of thing with regards to the reporting of these sort of things because they're all locked and coded within an existing system. Furthermore, with an integrated absence management and disability management approach, you can also track all the relevant things that took place associated with that so that it allows the removal of an awful lot of the guesswork and the subjectivity that sometimes impacted these sort of things in the past. So from our point of view, the power of data really must be harnessed effectively. And obviously, one of the items that goes along with that, which unfortunately is not necessarily used to its full potential, is that the presentation and the consumption of that information is not necessarily as easy as it could be. And in some organizations, they collect great data, but they don't report on it as well as they probably could. Therefore, it's not consumed or used by management in order to improve business practices. In other organizations, they may not do a very good job of collecting the data in an accurate and timely sense, but they may present it and consume it quite readily. So I've seen both extremes within industry out there. So obviously, cost control associated with good management and linkage with that early intervention process that we chatted about really provides an added value above and beyond that. So this is a slide that depicts some work that I did with the Conference Board of Canada, which is an applied research organization in Canada that's really focused on helping organizations add value through a variety of different mechanisms. So what we did here was we cataloged and categorized and then compared an awful lot of mechanisms to manage and track absences in the workplace and then institute disability management solutions where need be. So this is sort of a snapshot of how things could work in an ideal sort of state with regards to individual organizations' approach to this sort of thing. Obviously, you want as many workers as possible to be on the left-hand side of the chart here. Obviously, at work and productive is really the name of the game. Interventions at this level typically focus on the prevention. Hopefully, the employee status for the most part is healthy, and the employer focus tends to be on health promotion. We've got a huge issue with chronic disease out there, type 2 diabetes, cardiac disease, lung disease, that sort of thing. And obviously, any mechanism that you you can drive towards helping to promote healthier lifestyles and helping employees manage the risk associated with that is well worth their efforts. You know, and one of the things that I look to is the explosion of wearable devices, and using the data associated with wearable devices such as Fitbits and Garmins and things like that to track physical activity. And we know that we can define risk relatively accurately with regards to that sort of things. Give people real-world solutions and real-world applications to help them lower their risk over time. And obviously the benefits that go along with that from an organizational perspective are decrease in healthcare costs and increase in productivity, decrease in absences, and so on and so forth. Here we're talking about health risk assessments, information sessions, work-life balance, physical activity promotion, that sort of thing. Obviously, there shouldn't be a return-to-work sort of strategy. If anything, there should be a stay-at-work sort of program initiated, which hopefully won't kick in until you get into the yellow side, which is the sick leave piece. The next after the at-work is the incidental absences. So in some instances, if you don't have information on this, you know, you could be missing the fact that a worker could choose to be randomly absent, you know, every third Tuesday for a long period of time. If you're not tracking that sort of thing and looking at it, it's not really that helpful. Now, there could be a good reason. You know, perhaps this person is on dialysis and needs to be absent at that point in time and was very apprehensive about letting their supervisor know because they were afraid of losing their job. Or it could just be that, you know, they go on a bender on Tuesdays or on Mondays after softball and aren't really able to make it into work the next day. So there's a myriad of different things or reasons as to why people are absent from the job. But at the end of the day, if you don't have accurate information on tracking that, then you really can't intervene and either help that worker in terms of supporting that return to work or help them find a new job. Obviously, you know, here we're focused in on the health risk management piece. So these are the HRAs, the behavioral pieces, stress management, all those sort of things. And where the absence piece really kicks in to a much more significant degree in terms of disability management are the sick leave, the short-term disability, and the long-term disability pieces. Here, early intervention is the name of the game. We know that we've got a tremendous amount of research that shows that, you know, the earlier you intervene and introduce the concept and be able to support safe, sustainable return to work for workers who are off, the greater the likelihood of success. And we know that, you know, staying away from work, if you've got back pain or something along those lines, is not a very good solution for anybody. And the longer people are off, the less likely they are to return to employment. So, you know, a good, solid, robust system can be in place in order to support these sort of things. But you really need to know in real time when people are not able to attend their regularly scheduled days or their shift accordingly. It all starts there. And if you haven't got a good handle on that, as I said before, if you're using payroll data or something worse than that, you know, you could be a month before you know that these sort of things are occurring, which does not set you up for success as it could be had you known about it from a day one sense and a real-time absence piece. Now, in terms of data, you know, what I like to do is follow the data footsteps. Really what we want is codified and fielded data along with some pre-forward text. And whatever system that you use really should have the ability to input in some pre-forward text at some point in time, mostly due to the absence management piece and the disability management. Because in discussions with workers, although a response on a checkbox may indicate one thing, but the worker may disclose a little bit more information than they probably should, which it could be useful to jot down within a free-forward text sort of component. Obviously, from an analytics point of view, the codified and fielded data are the ones that are focused in on to help drive those solutions and really add value to the data. So this next slide is going to describe that data process a little bit. With regards to moving towards a robust absence or disability management tracking and reporting solution, it really all starts with the data. And of course, there's a lot of information and a lot of mini steps that need to take place prior to that. You know, the system or your data have to be accurate. They have to be collected appropriately. There's a fair bit of thought that needs to take place in order to set up the system for success by making sure that the data coming in are useful and add value to the organization. But a lot of organizations think that that's the end of it. You know, once they get the data, then the problems are all gone. But, you know, that's not really the case. You actually have to use the data, and you have to go through several steps in order to make sure that it actually leads to something meaningful. So once you have the data, assuming that it's being looked at and being consumed in an appropriate manner, then you have information about the workplace. So in this case, if we're tracking data from a day one absence point of view, we've got a bunch of data. It's leading us to give us information. That information should in turn give us some knowledge about where the workforce is at any given point in time. If you're looking at real-time solutions where you have a one-to-one ratio of workers and productivity, such as in trucking or something along those lines, where you can't send a truck out without a driver, and if the original driver calls in sick, well, how do you get a new one? How important is it to replace that worker, and so on and so forth? And there are automated solutions to help organizations out with that. StaffRelay has one, and I'm sure there's other ones that exist out there that can go out and reach out and find a replacement worker for you and put them into that place. Send them a text message that can update a time and attendance scheduling system after the fact in real time, and then use that information to drive forward. So that knowledge is very powerful. Now, that knowledge should really lead to insight, but at the end of it, you're really looking for action. And action is the most important step, because this means that you're actually taking the information at your disposal, you're processing it, either running it through analytics or getting to the point where at the end of the day, you're looking to make an action. So an actionable decision. Extremely important that we get to this stage. Otherwise, you end up with a lot of organizations that they've got, gigabytes and terabytes of data sitting on their systems that they're not really using it for, and it's just being accumulated there on the back end. Nobody really wants to see that sort of thing happen, but unfortunately, I've seen it happen in several different organizations, and it's my understanding that it's a fairly commonplace practice. You build and design a system for the best of intentions. For whatever reason, the employees don't use it to the degree that they probably should, and the data tend to accumulate. It kind of loses meaning when people don't really understand why the data are being captured, and at the end of the day, nothing is really done with it. So one of the questions that I like to ask organizations that I work with is, what are the implications for your action if your data way at the front end are inaccurate and valid? Well, it really makes the action that much harder, because you don't know if you're doing the right thing for the wrong reason or the wrong thing for the right reasons. A general rule of thumb in many instances is that if you put garbage into the system, you're going to get garbage out. So really, a fair amount of effort has to be put in on the design of the system to make sure that it's yielding the most appropriate information to help it add value to organizations. So if we take what we just talked about in terms of data, information, knowledge, insight, and action, and using those sort of systems and apply it back to the absence sort of paradigm, what we have here are two different ways to report on an absence. The top one, without an automation, an employee either phones into a network or sends an email, depending on whatever process that an organization has. They can talk to their supervisor, they can talk to HR, they can talk to a guardhouse. Usually a verbal communication takes place. And then somebody usually has to manually enter that sort of information within an HRIS or a time and attendance sort of piece. If you're using an automated solution, what you're doing is introducing either an IVR or a smartphone or web-based application, or a portal through a desktop browser or a mobile browser that somebody in a call center is using to capture that information in a regimented sort of way. Once that is done, the details of the absence are all standardized. Everybody's using the system. It's going to be far more successful, and then you can actually start to analyze that data to add value. You can report it in much the same way that Dave showed that what Fraser Health does, and that's just one example of all the neat things that can be done, and obviously lead into the whole concept of managing and tying action back into these sort of things. You can notify people who need to be notified, either via SMS text messaging or sending out emails so that there's a good solid paper trail. Obviously look at things in real time via dashboard or through another complicated set of SQL statements if you want to run and hit the data and look at it from different points of view. And obviously pull the data out and analyze it based upon, individual employee data or department or supervisory schedules. Anything that you can possibly put in as a data qualifier can be looked at. Now, from my point of view, there are a few critical success factors. You pretty much have to have support at all organizational levels from your stakeholders, in other words, your unions and your management, your leadership, and your frontline staff, in order to make sure this is successful. And that is directly related to utilization rates. So in organizations that have the highest utilization rates for automated tracking and management of absence in the workplace, if there's no end run where i.e. an outside capture, so somebody phones a supervisor and then that's the chosen method of reporting instead of actually capturing the data, you end up with an incomplete data set, and then obviously if your data aren't as clean as they could be, you run the risk of making improper decisions. So what you want to do is push as many people through your systems and your processes and your communication package to make sure that you're driving as high a utilization rate as possible. And some of our customers, they basically say that if the absence is not recorded via their automated solution under whatever name that they want to use, then that absence never occurred and you won't receive credit for it on your pay statement, things like that. It's a very good way to get employees to really take notice and follow the proper procedures. Obviously, what you want to do is collect meaningful and accurate data, and then obviously use the data. I've been involved with many organizations where the frontline staff don't see the value because they don't believe that the data are being used. So it's not just the end goal to collect it; you actually have to use it. And obviously, integration within other systems and processes, decreasing your duplication of effort is definitely really what you want to focus on. So in terms of absence and disability management, really, we want data to be a good, solid foundation. You're looking at things related to your direct costs, your replacement workers, your overtime, identify your cases for early intervention, your occupational, non-occupational sort of bins, if you will. So workers' comp, FMLA, casual and incidentals, coupled with non-planned or unplanned. At the end of the day, when you initiate return to work sort of processes, it shouldn't matter if a worker was injured on the job or off. The processes should be the same, although you need different forms and things like that. But at the end of the day, collectively, the goal really is to facilitate that return to work as early and as safely as possible in order to make sure that workplace health and productivity paradigm is maintained. Now, from an analytics point of view, what I like to talk about are the dashboards that, great for real-time analytics. That you log into a system, you take a look, you've got a good real-time assessment of where things are at in terms of your workforce. And as I said before, if there's a one-to-one ratio between productivity and a worker being there, obviously having that information at real time. So, in Dave's case at Fraser Health, if they had 8 nurses of a total of, 20 nurses on a given ward, all reporting sick, could that be an indication of an outbreak or a mini outbreak going on in that particular ward? Is a bug traveling around there or something along those lines? Is that impacting service delivery? Is that impacting customer expectations and all things that go along with that sort of thing? Lots of different examples as to why you want to look at these things in real time that go beyond the sporting stuff that Dave mentioned, even though that's extremely important because it's absolutely wonderful to know the impact or predictive impact on, every day throughout the year in terms of your productivity and your attendance in real time, so you can, make the changes that need to be made. Obviously, what you can do is have canned reports that are either run on demand or pushed automatically to the system. Which are very helpful for people because not everybody wants what a dashboard given or provided by a system does. Some people have extra questions, and some of the times they'll just pull the raw data and write their own queries to tie into that sort of thing. So having the ability to do that from an analytics point of view is extremely beneficial. And then, of course, the ability to create ad hoc reports. So if somebody has further deep dive sort of questions, having the ability and the flexibility to get to that. I used to run the occupational health department in a large city in Canada, about just under 1 million people in total, with 17,000 workers. And because it was a municipality, you had the government folks always interested in what was going on. So the folks, the elected officials, were always worried about the perception of productivity in the government. And what they were worried about was the perception that on Fridays and Mondays, nobody would show up for work. Well, there really wasn't an easy way to do that other than, pulling a massive amount of SAP or PeopleSoft data and running analysis accordingly. And, of course, this is 10 years ago. It's gotten a little bit easier since then. But, with using an automated approach to this sort of thing, you could actually assess the impact of that and verify whether or not that statement is true right from the get-go. So obviously you need expertise and knowledge in how to interpret and decipher all this information. And of course linking that to action is absolutely required in order to be successful. So from my point of view, the true value add for automated tracking and reporting to more effectively manage absenteeism and disability in the workplace is not really the system or the processes itself, because there's lots of good options out there in terms of day one through whatever needs to be done. But at the end of the day, it's really how the data are generated, how they're interpreted, how they're analyzed, and how they're used as the foundation for that absence and disability management solution that ultimately is where the rubber meets the road, and that's the most important thing from my point of view. So on that note, we can open it up for questions. I believe JC is going to act as our moderator.
Yes,
I'm sure you've got a lot of questions for Dave as well.
No, there's actually no questions that I see, and I'm going to invite everyone to go ahead and use the question section or the chat section to write in a question if you have any. Otherwise, I see that I'm actually just going to see if anyone has any questions.
I'm sorry, I don't see the opportunity to ask a question on the screen, but I have a question. Can I ask it this way?
Absolutely.
Okay, thank you. I was very impressed with Fraser's performance and around improving a lot of their LTD experience. And I was curious. I didn't hear much about the health record, though. Is there something about the way the system works where you were able to access the health record in a better way or a more accurate or quicker way?
Yeah, thanks. Thanks for the comment. We had several new releases of our system, and there was a full rewrite of the disability management module, and it added in essentially the real basic stuff. It added in all of the key milestone dates, etc., through the course of the case management. And that allowed us to start to look at individual performance of our DM staff, as well as how our improvements, lean improvements, were actually implemented on the ground level, so to speak. So that we didn't before had all of our key milestone dates in the system, and that allowed us to show how our process was going. So date of illness or disability we had, but from then, date reported, date of first contact, date of actual contact, date of entry, and when we received the forms, etc. So that was added, as was the ability to chart, actual charting, and add attachments, so photos, letters, documents, that kind of thing.
Okay. Did this system allow you to kind of map some of the medical data into the trending piece that you get through the system, where you could see kind of certain types of health issues that were existing and able to act on that in a better way?
Yes. So we had some general categories. We also had be able to codify people's quote status. So they were looking at we could flag them as return to work imminent. So we knew we would codify them as not needing services immediately because they were just recovering from flu, say, or something like that. So we were adding several types of codes into that. So types of conditions, as well as sort of their quote prognosis or status. And then, we are also then able to see if we had flagged somebody as not needing services, and all of a sudden they didn't come back, then we'd know that and be able to act on it.
Okay, thank you.
I have a question, if I can ask.
Absolutely.
Thank you. I'd like to hear more from Fraser, thanks for all you've shared, about what your disability management people actually do. Do they evaluate FMLA requests? Do they manage the entire workers' comp process? What happens once I get the tracking piece, and once it's turned over to them, what's the scope of what they do?
Sure. We have a phased approach. We have different occupations doing different pieces. So we have a triage group that make that initial first contact, identify primarily on the non-occupational side. They will identify need for services, types of services, has the person engaged with their family physician yet, bring in the union if there's hesitancy by the employee to engage in the program, because this is mandatory, as I said. So we have the triage unit, and they do the bulk of narrowing down the more complex cases. And we have in our collective agreement language criteria for, quote, complex. And then those complex cases are referred to what we have in our lexicon as a disability management consultant. And so those are certified disability management professionals, and they do then the entire gamut of disability management for complex cases. On the right up
now, Dave, what proportion of those are occupational health nurses by training?
1 out of 17.
Okay.
Wait, I'm sorry, you said 1 out of 17?
Yes.
And so is your total staff 17 for your entire company?
For the disability management consultant, we have triage staff. There's 5 of them. And then we have return to work associates that manage, there's 5 of them as well, that manage the 80 to 90% of our workers' comp claims and return to works. So they're kind of a mid-level knowledge worker, so that because of the law and policy of our workers' comp system, that we're able to have about 80 to 90% of our cases run through that group, and then only a few of those workers' comp cases go over to the disability management consultant level. The disability management consultant levels also attend to the duty to accommodate cases as well.
That was my next question. Do you have a separate group that handles accommodations? We
have two senior level folks that are occupational health physician, foreign trained occupational health physicians. So they do a lot of the complex medical duty to accommodate for us.
And do they work with HR, or are they employed directly?
Both, and the union. So we have a joint duty to accommodate partnership with our HR staff. So they're charged with the finding of jobs and negotiating placements, etc. Once my team have identified, limitations, abilities, prognosis, that kind of thing.
Okay, great. So we have 2 more questions that were asked to the portal. One was by Christine. How many disability managers are performing the DM function for the size of the organization? Do they have credentials? Are they RNs?
So the senior disability management folks are about 20. The credentials is they're a certified disability management professional, CDMP. They come from a variety of backgrounds. We have occupational therapists, we have OHN, kinesiologists, people who have run rehab clinics, but we do require them to have their CDMP designation. Okay. The 2 managers that run the process have their master's degree in disability management and CDMP as well.
And then the second question was, do you have any suggestions for convincing leadership of the need for systems when things appear to be getting along?
Yeah, well, the trigger for us was our CFO getting the letter saying, if you have unfunded liability, you need to send us a check for, I can't remember how many millions, but that was good start. It's really about, as Tyler described, it's about having the data and the ability to demonstrate that on a much more dynamic, real-time basis. And it almost came down to sitting down with individual vice presidents or others in charge of large hospitals and showing them what was happening and what was available, and that really started to show them and convince them of the need to invest in this. The flip side, of course, is that you need to be able to have that data to be able to convince them. So it's a bit of a struggle, but going through the Lean Six Sigma review that we did added a lot of credibility to our ask for our investment in the systems, and they weren't huge investments, but getting all the data in one place and using one system, and then as Tyler referenced, the key point for us was having our executive team implement a policy requiring mandatory reporting through the EARL system. And we have an audit process to identify people who get coded sick time who haven't reported through the EARL system. And you do not get paid for your incidental sick days. And we've got about 96% compliance with the EARL, and to be perfectly open, the 4% compliance are our management staff that don't necessarily use it.
Are you self-insured for everything?
The workers' comp, it's a rate group of there's 6 health authorities in BC, so our 6 health authorities form that rate group. Same with long-term disability, and so it's a combination of self-insurement and as well as the investment pool for those rate groups. And we pay the accrued sick time as part of our base budget. Yes.
Okay, great. And are there any more questions? I think we have time for about 1 or 2 more. Excellent. Well,
I do have one more question. I'm sorry. So if
okay.
if HR gets an accommodation question, are they required to run it through the staff, the disability management staff, or do they only escalate the things that are more complex?
They're required, as long as if it has any kind of medical connotations, then it's required to run through disability management as well. If it's accommodation for religious or family issues, then no. But
and what are your total employees?
About 24,000.
Great. Well, I would like to go ahead and wrap this up. Thank everyone for attending and participating. Thank you, Dave. Thank you, Tyler, so much for taking the time out of your busy schedules to afford IBI and its members this educational experience. If anyone is curious about additional resources regarding this session, we do have the slides that were provided on the forum website under past forum presentations. If you're having difficulty finding that, you can feel free to email me or anyone in my organization. And if you would like to reach out to either Dave or Tyler, as you can see, they have provided their email address if you'd like to ask them some more questions about their program and design.